Preparing the birth room. A room ready for birth needs to be warm, light, clean, private, and supplied with all needed equipment. This video will show you how to prepare the birth room. Use a checklist of all needed supplies and equipment. Keep necessary items close at hand to access in an emergency. The surface of the table should be firm and washable with a clean cloth on top. Place supplies on the side, keeping a central area clear in case the baby needs resuscitation. In a nearby cupboard, store items only occasionally needed, such as suturing supplies or medications. A light over the table can help warm the baby as well as provide light to check the condition of the mother and baby. A more focused light source is helpful for tasks like suturing. Have a clock with a second hand and a wall thermometer. To monitor the labor, have a partograph and a fetoscope. Always be ready for resuscitation. Have a newborn resuscitator bag with 2 face masks, 1 for a normal size baby and 0 for a small size baby. Have a stethoscope if available. Have a bulb syringe to suction if needed. For the birth, have 2 pairs of sterile surgical gloves, 2 towels to dry the baby, a hat, and gauze squares. Have a delivery kit. The kit must be sterile and contain cloths, cord clamps or ties, 2 artery forceps, and a new razor blade or scissors for cutting the cord. To prevent postpartum hemorrhage, have a syringe with 10 IUs of oxytocin or, if not available, 3 tablets of misoprostol 200 micrograms. Have a blood pressure cuff. For newborn care, have vitamin K, eye prophylaxis, and a baby scale. To prevent infection, have a way to wash hands and safely dispose of waste. You will need clean running water from a tap or pitcher and soap. For infection prevention, have a tray with 0.5% chlorine to decontaminate instruments, a placenta pan, and a bag to dispose of it, a container for soiled linen that's leak-proof, a plastic container with a plastic liner for medical waste, a sharps container. For blood splashes, have an apron, a mask, and eye protection. Encourage the woman to have the support of the person of her choice during the labor and birth. Provide a chair for her. Have a pen and forms ready for recording clinical information. Provide warmth and privacy. Use curtains and close doors and windows. After the birth, clean and disinfect equipment. Clean the room. Be sure all is ready for the next birth. Remember, use a checklist to routinely prepare the birth room. Have all supplies on hand and ready to use. Keep the birth room clean.